Betaine, also known as trimethylglycine or TMG, is a substance that's found in spinach, whole grains, and seafoods. Normal consumption of TMG from the diet is about 100 to 350 milligrams per day. TMG can be a very valuable supplement that reduces cardiovascular risk factors and increases lean body mass, but if you don't take it in the right conditions, it can be totally ineffective, or even worse, it could increase some cardiovascular risk factors. So today we've analyzed the data from human clinical trials, and we're going to present to you the best way to take TMG so that you can get the optimal benefits without any of the potential risks. With respect to improving muscle strength, muscle power, and body composition, the clinical trials that did not include exercise in the treatment protocol found no improvements at all. But the clinical trials that involved TMG supplementation along with high-intensity or high-resistance exercise found improvements. For instance, just 1 week of TMG supplementation at 2.5 grams per day improved cycling sprint power, while other clinical trials have found improvements in lean body mass. So the first rule to remember about TMG supplementation is to take it along with exercise. The most recent clinical trials that tested TMG supplementation alongside exercise also decreased cortisol, which is a major stress hormone, and increased growth hormone, which helps with muscle protein synthesis. With respect to cardiovascular risk factors, TMG supplementation is actually approved as a drug to decrease homocysteine levels. Homocysteine has been linked to inflammation, depression, specific forms of dementia, and various forms of cardiovascular disease. TMG is trimethyl glycine, and the way it improves homocysteine levels is to donate those methyl groups, those 3 methyl groups, so that the homocysteine is easily converted to another amino acid that's not associated with cardiovascular disease, dementia, or depression. The trouble is that the studies found that supplementation with 4 or more grams per day of TMG significantly and adversely affected the lipid profile, which is another risk factor for cardiovascular disease. So the second thing to remember about TMG supplementation is to make sure that the dose is greater than 360 milligrams per day and less than 4 grams per day. The third and last important fact to remember about TMG supplementation is that in order to get the optimal benefits of decreasing homocysteine levels, you cannot have any nutritional deficiencies. In other words, if you have a good diet with lots of green leafy vegetables, no worries. But if not, supplementation with a multivitamin would be recommended along with the TMG supplement. In summary, the clinical trials that are available at this point suggest that TMG supplementation will result in significant increases in muscle strength, muscle power, and body composition, as well as significant decreases in homocysteine, yielding follow-on cardiovascular and neurologic benefits, but only if, number 1, the supplementation dose is 360 milligrams per day to no more than 4 grams per day, and number 2, the supplementation is taken on the days that you are active with resistance or high-intensity training. And in order to get the full benefits of the decreases in homocysteine levels, you must be nutritionally replete, meaning that if you don't have the ideal diet, include a multivitamin supplement along with the TMG. If you do decide to supplement with TMG, I'd be really interested to know why and also know the benefits you found, especially in the first 23 days. So post those in the comments section below. Thanks for joining in, and I'll see you in the next video.